Primary eye care is such an ignored cause in the country, and it's something that's been bothering us. And that's also why, as a business, there was focus on making eyewear accessible, but that's not where the whole story ends. It is so much more about making eye screening accessible.
Good morning, everyone. Today we have with us Ms. Nidhi Mittal Bansal, Chairperson at Lenskart Foundation. Nidhi will be sharing with us the journey about Lenskart Foundation, their vision and mission, and about their programs across India. We are really glad to have you with us, Ms. Nidhi.
Thank you, Asta. The pleasure is all mine. Thank you for calling me here. It's very important that we at Lenskart Foundation communicate what we're doing, primarily because it is such an ignored cause in especially our country. It's very important to bring that focus to primary vision care.
Absolutely true. Absolutely true. So we'll start with the impact talk. My first question is, tell us a little bit about how Lenskart Foundation came into being and what was the idea behind its inception.
Uh, so the Lenskart Foundation was conceptualized formally in 2020, in the middle of the first wave of pandemic. The thought primarily started with us as families sitting and thinking, there's so much happening outside, there's so much suffering. How do we give back to the society? We when we have the means, when we can add to making lives easier for people, what is it that we should do? So we were struggling with a lot of ideas. We were thinking, what is the big problem that we can solve? Because there are a lot of good hearts out there. So then we, Piyush and I have been undertaking small CSR initiatives over all these years, but nothing really big and substantial or sustainable. We would do small camps in for underprivileged people in backward areas, tying up with other NGOs. But like I said, nothing sustainable. So this probably brought us to the thought that primary eye care is such an ignored cause in the country, and it's something that's been bothering us. And that's also why, as a business, there was focus on making eyewear accessible, but that's not where the whole story ends. It is so much more about making eye screening accessible. And that has a lot of roots to it. There are a lot of roots and stems to it. You can't just create camps everywhere to make eye care accessible, primarily focusing on uncorrected refractive error, which simply means that people should have access to regular 7-step eye test, which tells you whether you need glasses or not. To just simply define what uncorrected refractive error means. So we thought, why not? We have expertise there. We know we can tie up with right people. We know we have the right outreach system in place. Why don't we go ahead and initiate our steps into ensuring that over next 10 years or 15 years, we've made our country refractive error free? And that would happen through 3 main objectives. First is awareness. You can't do it unless you tell people how important it is to get their eyes tested. And then, of course, to ensure once they've gotten their eyes tested, they know why it is important to wear glasses if they need them. So awareness is a very, very important aspect of our existence and also for primary eye care. Now that, of course, it's multifold, and I'll probably answer it in your following questions. Then creating accessibility, which means you have enough number of optometrists in the field. The ratio is really dismal right now. We have one optometrist to almost 1.25 lakh people. The statistics are really scary, and it's a long way to go for us and other people who've been working in vision care. And the third is technology, right? You need to get, eye testing is expensive. The equipment is expensive. The whole process is long, making it expensive. So how do we create more affordability there? So we created our aspects, we started, and so that's how we sort of thought that Lenskart Foundation is just the right step right now. And Vision 2020 by WHO was already going on, a very, very inspiring initiative. And the fact that even they face challenges with fulfilling it or achieving the success of that initiative told us that more hands are needed.
Very rightly said. That's really beautiful to hear. The journey, how the Lenskart Foundation came into being. You shared with us briefly about what the organization is trying to do. What are your goals? We would like to understand a little bit more about the program model that you have and who are exactly the beneficiaries of this program.
Right. So Lenskart Foundation, we've already got our hands into more than a couple of projects. Focus is on children because they are the future of the country. And let me give you a little statistics here. India is the blind capital of the world. 40% of world's blind population lives in India. And 75% of that blindness is avoidable blindness, which means if those people were given access to eye checkup at initial stages and they wore glasses, they wouldn't have gone blind. Now, avoidable blindness is carrying forward generation to generation, right? The same problems exist from one generation to another generation. Now, how do we stop it for the future of the country? How do we ensure the next generation is aware enough and has enough access to primary eye care? Is by focusing on children, right? While Lenskart Foundation is giving eye tests and doing screenings, giving away glasses to adults, but we're focusing on school children and underprivileged children in general, so that we can, for tomorrow, we can avoid this avoidable blindness, right? And ensure we don't have this title of being the blind capital of the world. We don't like this title at all, right? We'd rather be the most progressive country. We'd rather be the country with the right and perfect vision than being the blind capital of the world. So the program model, and whether we're working for vision correction for safety on roads or we're working for vision correction of children, the program model is, like I said, make eye tests as accessible as possible, reach out as much as possible, then ensure people have enough awareness for them to first come for an eye examination. We've been doing this for over a year now, Astha, and it is difficult to mobilize people. It is difficult to even, we're opening child eye care centers in very strategically chosen locations. We ensure that at least a 4-kilometer radius has enough number of clusters, slums, government schools, etc. And even there, and we provide free eye tests and we give free eyeglasses, by the way. Even then, we've had a hell of a time to get people to come to the center. Now, of course, we have almost 100 to 150 people queuing up every morning outside our centers. But the initial stages were very, very difficult for us. We felt very lost on, how should we go about this? But awareness is so important for any of this to be a success. So the program model is that we ensure that all of our people on the ground are speaking to each and every person who comes for an eye test. They know what is it to get your eyes tested, how can it improve not only your vision but also your lifestyle and the life of your family members. Because for the main earner of the family, for the main homemaker of the family, for the kids of the family, unless and until you're living with clear vision, your life cannot be normal. I'll come back to those statistics also for you on the impact it has on people, their lifestyle, etc. But again, so awareness, mobilization, outreach, enough outreach, ensuring everybody who walks up to us gets a proper eye test. And if there's power, we ensure they get glasses, and then we ensure there are follow-ups also. So we follow up every 3-4 months with every patient. We maintain a robust database of every patient who comes to us, whether it is through our mobile vans or at our centers or any of the other camps we are setting up. We have a centralized system of recording all the data of all our patients. So that's about our program model.
That's an incredible program model. I mean, all the important elements, be it the mobilization of the communities on ground, creating awareness in them about the problem first and then providing them with the solution is an absolutely incredible model again. I think in your answer, you were trying to highlight how preventive eye care is so very important. My next question is about that. Why is preventive eye care important? And what are some of the key principles one should keep in mind while carrying out eye care initiatives on ground?
So, like I said, preventive eye care is what makes you lead a normal life. We have, and it's not just a rural India problem, let me clarify that. It's as much a urban India problem. And it's a problem that's marred by various other issues. Preventive eye care is still not accessible, even in urban India. Sitting here in Delhi with, so many Lenskart stores, so many other brand stores, which all of them are providing free eye tests in their stores. You have so many eye hospitals. A lot of those hospitals also again provide free eye tests. There's so many hospitals today, with government support are giving free cataract surgeries. And that procedure again, diagnosis begins with an eye test. So with all of this access also, there's not even a single city where you can say that even 50% of people are going and getting their eyes tested regularly. Right. So access problem is there, but coming back to your question, preventive eye care is important because unless and until you can see clearly, you can't have a normal life. Your day-to-day functioning is reduced drastically. It's just destiny. So when I was a journalist in mainstream media, I took this small vacation with my cousin who was in IIT Delhi and with his batchmates. They and I, because I was a journalist and I was curious, so we were all backpacking to Pondicherry, and there was this one friend of my cousin. He used to wear really thick glasses, and both his parents were very well placed professionally at very high positions in their respective companies. So I'm talking about a very educated, well placed Delhi family. The child is in IIT Delhi. That's an accomplishment in its own way. He used to wear really thick glasses. Samay pe these thin microfiber lenses weren't there. I'm talking about almost 17, 18 years ago. Now, of course, you have high quality lenses, but at that time, he used to wear really thick glasses. And I used to always keep looking at him. And, I sat down to speak to him and I got to know that till class 11, his school did not do a health checkup that included eye tests. And for him, the world, and he never wore glasses till class 11. And for him, the world was the way he looked at the world. It was blurry. Of course, he got to know it was blurry once he wore glasses in class 11. And he had tears in his eyes when he was narrating how, when for the first time, his school conducted an eye test and he wore those big glasses in which they put lenses to test your eyes. And suddenly everything became so sharp that he had to close his eyes. That's when he realized, his parents realized that he lived with bad vision. And for them, and he wasn't even a smart kid. Class 11th changed his life and he was in IIT Delhi after that. But he was a below average to average student. Before that, he used to face multiple health issues. Parents would say weak bachcha hai, health wise, bimar rehta hai. All of that happens, and it is such a common scenario in all families. Now with our child eye care centers, we hear all of this so often. Our second child eye care center has been opened in a school in a village in Ghaziabad. The school is by Rasta Foundation. It is for underprivileged children. And we found so the school has 350 students. We've, of course, first screened all the students in the school. There were at least 10 kids whose parents came and told us, इसको तो अब स्कूल से निकालना पड़ेगा, पढ़ाई वढ़ाई तो करता नहीं है, तो वैसे भी आप क्या करोगे इनकी आंखें टेस्ट करके. Of course, we insisted, screen the kids. One child had a -6 number, the other had -10.5. So this is what happens. Myopia is a big cause of high school dropout rate, right? So these are some of the concerns that you address at a very, very early stage, but this is such an urban problem. It is just not a rural problem. You talk of educated people, you talk of well-placed families. It's just ignorance, and stigmas. There are still so many stigmas related to wearing glasses, even as it's a fashion accessory, and there's a whole lot of things happening around eyeglasses. The biggest designers are now designing eyeglasses, but it's still a huge stigma. People still think sar dard hai, thakaan ki wajah se ho raha hai, main bahut kaam karta hu isliye ho raha hai. They don't know that they can cure it with just wearing the right glasses. Right pair of glasses can just improve on their lifestyle so much. Their productivity can increase 10x, and we have data by WHO, World Economic Forum. They've all released data on what impact right vision care can make. Right. So I mean, it surprises us every time we go back to the data, and whenever I speak to people, I see that surprise on their faces. But there's still a very, very long way for all of us to go. So bringing that focus on the entire problem is very important.
Thank you so much for sharing that, Nidhi. That's very, valuable input on how preventive eye care is so important so that a child is able to lead a happy childhood. Uh, we also understand that eye care is generally not seen as part of the primary health checkup.
Yeah.
Do you think covering eye care under the ambit of primary health checkup will resolve a larger chunk of the vision problems in the country?
Absolutely. Absolutely. And I say this because Europe, a lot of European countries and the United States of America, they all live on these health insurance policies given by government, and they're widely used, right? So the government really supports a lot of healthcare issues, and primary eye care is part of their health insurance policies. In India, we still don't do that, right? There's a lot of focus on cataract surgeries, thankfully. But what I feel we are still ignoring is the focus on primary eye care. And I understand the reason. I've spoken to people at Ayushman Bharat, I've spoken to people at Niti Aayog. But the reason is data collection. It's something that has to be so regular. It's not something that you can conduct a surgery and address it. Primary eye care needs you to regularly test your eyes, ensure you're regularly wearing your glasses on a daily basis if you need them. And over a period of time, your vision gets better, your lifestyle improves, your family life improves, your livelihood improves. So it is something that probably the government and state governments would find very difficult to keep up with. But nevertheless, we need that focus. And kudos to some of the South Indian state governments. This Telangana government, Karnataka government have been doing so much in the primary eye care space. They provide free eye tests to everybody in the state. They ensure they tie up with the right players to get free eyeglasses for everybody. I am really, of what some of these South Indian governments are doing, state governments are doing. And that is what each of us have to do, right? The moment it becomes part of the main healthcare system, a large part of the problem will be solved, because people in need are still looking for government initiatives in everything, especially healthcare. Our government's been doing a lot of work in healthcare, but this is still an ignored aspect, right? Ensuring everybody in our country has enough access to eye tests, and but we understand the reason. We still have very very few optometrists. I gave you the number. In urban cities, our numbers are still one, the ratio is 1 is to 55,000. In rural, it is 1 is to 1,25,000. So, I mean, we need to create more occupation in this particular profession. We need to make it lucrative. But also, we need to work on technology that makes it more affordable to conduct eye tests. The autorefractometer, all the equipment's still very expensive. But we see, Lenskart Foundation has been doing a lot of research and development over the last 1 year. We've been testing equipment being developed all over the world. There's a lot of work happening. So we have some really positive light coming from the future, near future. There are a lot of startups working on more compact vision care equipment and more affordable vision care equipment. So in near future, at least this problem should be resolved. And we, with the help of other social impact organizations, creating partners with them, we would be able to take this to hopefully each nook and corner of the country. Creating more optometrists will still probably remain a challenge that all of us will address together. We need to create that into a very lucrative career option for more and more people to come and join it. And there are efforts happening in that direction. So let's see how that goes.
Very beautifully put. I mean, like you very clearly highlighted some of the major challenges being faced when, considering the eye care initiatives in the country. We would like to understand from you, what are the major socio-economic implications of vision impairment problems for the masses and our nation as a whole, in fact? And is there any link between visual impairment and the poverty cycle?
So there are major socio-economic implications of vision impairment problems for the masses and our nation as a whole. Vision care is an important agenda of 2030 SDGs. It's related to poverty education, economic growth, quality education, to name a few. So there's direct impact. Let me just read out some numbers to you. Provision of reading glasses can increase a worker's productivity by 34% and income by 20%. Poor vision increases probability of chronic ailments by over 20%. Over 60% of illiterate population are found to have uncorrected refractive error. Uncorrected vision can lead to potential GDP loss of over 0.8%, affecting employee performance by 20%. So, I think these numbers are telltale for you to understand, for everybody to understand that how much is there a link between visual impairment or visual clarity and the poverty cycle. And it is, we feel it's such a slow killer. Less than 25% of our country's population is aware about refractive error as a serious problem. They don't know the importance of eye care. And of the population of spectacle users, less than 20% of them actually wear glasses. I mean, they have a pair of glasses, but they won't wear it. So the numbers are really scary, to say the least.
I agree with you that even among the most educated people and the well-placed families, eye care awareness is still missing, and the importance of maintaining the regular hygiene to maintain your eyes is still very important. That awareness needs to go out again. But you briefly mentioned in your last points that how eye care is also related with SDGs and how it's all correlated. My question is basically aligned with that. You've already mentioned some of the SDGs that are aligned with the eye care initiatives. Tell us a little more about them. And do you think why this alignment is there with the SDGs, and how is it impacting the SDGs in itself?
Uh, so to begin with, Lenskart Foundation is on a mission to integrate with SDG 3, which says there should be 50% reduction in road accident deaths by promoting road safety. We've done, just to sort of stress on this one, in our initial project with Uber, where we set eye screening camps at their GLs in NCR and Bangalore and gave highly subsidized glasses to their driver partners, we found that most of them are in denial about their eyes being weak. A lot of them didn't have time to stop and get themselves screened. But what was alarming was that almost 35% of them shouldn't be driving without corrective glasses. Now, like I said, but eye care has still not been mentioned as only goal in SDGs, which we still need to promote by correcting awareness. But a good vision plays an important role in addressing these SDG 3, good health and well-being. SDG 4 is for quality education. And I think I've spoken enough to you about myopia being a cause of high dropout rate from schools. We want to address that at a very, very grassroots level. We've been conducting eye screenings and awareness campaigns at government schools and other small schools. SDG 8 is about decent work and economic growth. And that, like I told you in my previous answer with numbers, it's very clear that only if you can see clearly, only when you're getting your eyes tested regularly, wearing glasses, can you yourself create economic growth for yourself and your family. Then SDG 5 is for increased gender equity. Increased gender equity. There again, we ensure that women are as important an aspect of a family when it comes to healthcare as men are. So overall, it's just the everything connects and interrelates. So the alignment between SDGs and eye care initiatives is indispensable.
Thank you so much, Nidhi. This interaction has been really wonderful. We're really grateful that you joined us for this Impact Talk series today. It was wonderful to have you. We wish you and the Lenskart Foundation very all the best for your future endeavors.
Thank you so much, Asta. The pleasure is all mine. Thank you for helping us take our thoughts and our campaigns forward to more and more people.